Ah, eu estou a saber.
Bom dia, malta. Bem-vindo aos 7 Minutes to Convince Me. 7 Minutes to Convince Me. Ok? Um formato totalmente diferente em que vamos largar o que é socialmente aceitável. Ok? Está tudo preparado?
Sim.
Então, está tudo preparado? Está tudo preparado? Ok. E agora temos o prazer, senhoras e senhores, de trazer um convidado especial, o Dr. João Afonso, praticante de natação. Adora ir à praia, adora ver as praias de Cuba. Aliás, o seu próximo destino é lá, na parte da cirurgia oral. E como cirurgião que é, vamos ter a oportunidade de ouvi-lo a convencer-nos em 7 minutos porque é que o uso dos CBCTs são importantes. João, o palco é todo teu.
Muito obrigado. Thank you so much. Olha, Joe, isto está vermelho, o microfone. Não sei se... Pronto, ok. You're hearing? Okay, so maybe I'll start in English, okay? Sound check, all good. Again. So, where's the pointer? Where's the pointer? It's here. So, good morning everyone. My name is João Afonso, as Dr. Shen presented in this wonderful presentation. And today I'm going to convince you in only 7 minutes that the use of the CBCT exam is crucial in our daily practice. But today I'll do this in a very different way, and I'm going to tell you a small story. This is a story about a clinic that it's called Dental Clinic 2 Dimensions, and we are going to spend our 7 minutes with Dr. John. So Dr. John is going to present us some cases, and we are going to discuss and understand exactly how important the CBCT is. So let's go with him to the clinic. Well, first patient appears, and we see this panoramic X-ray Dr. John took. And Dr. John, what do you think about this? What should we do? Well, Dr. John sees that there's an apical lesion on tooth 41 and knows that it's required an endodontic treatment. So let's start with that. But there's something that sometimes is crucial for us to understand, is that sometimes what we see is not actually the reality. So if we take a closer look to a CBCT that was done at this patient, we see that the apical lesion that we were seeing at a 2-dimensional exam, it doesn't actually exist. So, Dr. John, I think that on this case, you didn't decide quite well, but it's important for us to see the symptoms, and it's important for us to understand what the evidence suggests nowadays. And what we see, for example, in this systematic review, is that we have to pay attention in some types of patients. Basically, when we have high difficult cases of endodontic treatment, when we have failed root canal treatment, we need the CBCT for evaluating the healing in terms of the periapical region, and also into cases such as the traumatized immature teeth, and also in external cervical reabsorptions. So, with this case done in terms of endodontics, let's pass to another case. And here we have a patient that comes to the clinic, and he has some pain in the region of the wisdom tooth, the 38. Dr. John appears once again, so Doc, what are we going to do? Well, he suggests that we do the extraction, and he thinks that it's going to be easy and that the tooth is going to come out in distally because he has space to go. Okay, Dr. John, so let's try it. Well, Dr. John tried, but the tooth won't come out. So let's do a CBCT and understand exactly what happened. Well, when we take a closer look at the 3rd-dimensional X-ray, we see that there is a relationship between the root mesial of the tooth 38 and the distal root of the tooth 37. And when we take a look at the axial cuts, we see that first they are separate, but at the end they are fused. And of course, these types of cases, it's important for us to do a CBCT and to have a proper evaluation, because this is the way that we can reduce the risk of intraoperative accidents and other types of accidents. So the panoramic X-ray in these types of cases sometimes hides some situations. So yes, we have to pay attention, Dr. John, okay? It's important. And this is actually what the evidence suggests. We see many articles that say that for removing wisdom teeth, we have to pay attention to the position of the inferior alveolar nerve, and of course this is due to the superimposition that we see. But also I brought here an article that talks about health and pathology of the maxillary sinus, and it explains that the accuracy that we have when we take a look into sinus septums, to sinus membrane thickness, to see oroantral communication, and to see types of anatomical variations such as pneumatization, the accuracy that we have from the CBCT is much higher. So let's go another case then. So I think that now in the third patient, Dr. John is able to understand that maybe, for example, in orthodontics, this panoramic X-ray is not enough. Well, is it enough? I think not, because especially in this case, what we see is that if you want to assess measurement points, for example, the relation between the inclination of the incisors and how's the vestibular bone, the CBCT is a crucial help. Also, to evaluation the need of orthodontic surgery, we have these cases that we have to do a CBCT. If we need additional treatment, such as retreatments of endodontic teeth, it is also important. And to predict a long-term and to have a stable diagnosis, we also need a CBCT. So, yes, John, I think that you're getting the point now. And once again, the evidence suggests exactly this. If you want to see in terms of craniofacial orthodontics to see maxillary expansion or evaluation of the clefts, we need to do a CBCT, and this has much more accuracy to evaluate facial asymmetries, to see obstructive sleep apnea, also to do the proper planning of temporary anchorage devices. I'm talking about the mini implants. The CBCT is crucial in these cases. So I bring to you another case. So a patient comes to the clinic and says, well, I need to chew on the posterior side, I need some implants. Well, Dr. John does here this panoramic X-ray, and what do you want to do, doc? Well, he thinks that this case is very easy. We just put 2 supracrestal implants, 12 millimeters length, because we have a lot of bone. So basically what Dr. John wants to do is that he wants to place here these 2 implants, and that's it. Well, it seems that it's that simple, but we have to take into account the anatomical structures, and we have to see exactly what happens. And as you can see on the CBCT cuts, we have here this concavity that would be hidden in any type of 2-dimensional X-ray, meaning that the CBCT is crucial to see anatomical variations, to have a customized treatment planning, to see and to have some time and resource saving, and also to risk reduction, because what Dr. John did in this case is that if we consider only the 2-dimensional X-ray, everything is fine, but if we could take a closer look, of course, that it's not actually like that. So obviously that the CBCT and the DCAM files that we have are going to help us to do the proper planning and to increase the predictability. We can also select the most suitable implants for the case, like we see in this one. And only with the DCAM files we are able to have guided implant dentistry. And also for proper documentation and follow-ups, you often see the use of the CBCT, and the periapical X-ray is not enough. So to do my conclusion, I thought to myself, well, if I had to do this presentation in only 7 words, the words that I would decide to have would be that the CBCT is essential for a precise dental diagnosis and treatment. And once again, I wanted to suggest again that the CBCT is like a rocket ship that goes into space, and it allows us to get out of the planet Earth and to have a planning treatment that for sure is crucial for the patient. So, yeah. we- Oh, the video is not going, but yeah, you get the point.
Dar aqui, João, vai para trás. Vai tu com o
Oh.
prato, aí. Vai atrás.
Yes.
Aí.
Ah, aqui.
Aí.
Ah. No.
Embaixo. Não está play.
Oh, I wanted us to go to space, but I don't think that we're able to go to space today.
Vai embaixo.
Well, the 7 minutes has stopped, right? But I think that you know already. That you know already the video. I don't know why it's not passing, but thank you very much for your. Yeah, thank you. Ah, bem, olha só. Não sei o que é que se passou. Não sei o que é que se passou. Oh, olha, pronto. Ficou a faltar o vídeo, pronto. Está diferente, pelo menos está diferente.
Há dramas em Prada.
Ah, um bocadinho depois já está diferente. Pronto. Achei que ando aqui uma história falando de casos clínicos.